Hello, everyone. I'm Olga Petryna from New York. I'm reporting from the ACR 2020 meeting, which is virtual this year. Today, I would like to share some updates on recognition and early treatment of macrophage activation syndrome. So there are several abstracts that speak about early detection and also outcomes in MAS based on the approach to treatment. I would start with the abstract 1496. Which is the study of outcomes of an evidence-based guideline for the treatment of HLH and MAS. So it's a great abstract. In this study, authors design electronic medical record research algorithm that would identify patients with oncology and rheumatology nodes with fever more than 38 degrees Celsius and ferritin levels of more than 500. They use this algorithm and then retrospectively identified patients who were hospitalized with about parameters, and they compared patients before implementation of evidence-based guidelines to treat HLH and MAS and after the evidence-based guideline was implemented. And what they found that amongst the patients who were identified as HLH or MAS, which was 12 girls and 15 boys of age 8 and more in this particular study, the outcomes changed tremendously after they implemented this evidence-based guideline. So it showed that the mean time for HLH and MAS diagnosis from the beginning of the symptoms shortened from 8.5 days to 2.5 days after the implementation of the guideline. Also, average hospital stay shortened by 5 days from 34 to 29 in patients who were treated based on the guidelines. And most importantly, the survival rate increased so overall survival increased from 75% before the implementation of the algorithm up to 93.3% after the implementation of the evidence-based guideline. The treatment of this condition hasn't changed much in terms of treatments used. So IVIG, steroids, and anakinra were still the most used medications, although the use of IVIG increased after implementation of algorithm from 35 to 53.3%. So overall, the study emphasizes on a benefit of having this guideline implemented for early detection and treatment of patients with macrophage activation syndrome / HLH. And then speaking of early detection and identification of patients with macrophage activation syndrome, there is another great abstract 1149, which speaks about the risk score for macrophage activation syndrome in patients with systemic JIA. So in this study, patients with systemic JIA, which is 69 patients, were evaluated and their laboratory parameters were measured and compared to patients who developed MAS as opposed to those who did not. So they measured ferritin levels, LDH, AST, and triglycerides in patients with or without MAS and found that patients who developed MAS tend to have those parameters much higher than the patients with systemic JIA without this complication. They assigned the score of 3.1 to ferritin of more than 750, the score of 2.5 to LDH levels more than 540, 2 points for AST more than 30, and 1.5 point for triglycerides more than 100. And this sensitivity specificity of this particular scoring system was very high. Sensitivity was 96% for construction cohort and specificity was 80.5%. And it was found that MAS risk score of more than 5 was seen in 27 out of 28 systemic JIA patients who developed MAS, as opposed to only 8 patients out of 41 of those who did not develop the complication, which again points out to the usefulness of the scoring system in order to predict patients at risk, which would help early identification and effective treatment of patients with this scary and serious complication. I hope you find this information useful, and if you would like to learn more about this ongoing ACR meeting, please visit us at Room Now, and we'll see you there.